This is Tom Biernacki, and I'm gonna show you how to fix your big toe joint pain right here. So I'm gonna bring it up right there. I'm gonna show you how to fix that. And it's not just gonna be having your husband or wife massage your joints. I'm gonna show you the top 7 reasons why you're getting your big toe joint pain and exactly how to fix it at home. And if you can't do that, I'm gonna show you who can fix it for you. So let's get going with big toe joint pain. Disclaimer, we can't actually give advice online, so don't listen to anything we ever say. This is Tom Biernacki. Click the subscribe button, hit the bell. We're bringing you the best, the most practical, time-saving, and getting in shape at foot advice there is. You won't regret subscribing to this channel, so sign up. Cause number 1 is the most likely thing to happen, and it's, surprise, surprise, a bunion. So when you look at a bunion, right here, as you come in on the big toe joint right there, a bunion is when the big toe joint bends like this. So it's not extra bone growth. People sometimes think it is extra bone growth. It's not arthritis in this case. What does happen is this joint buckles out like this. So what's happening is, as your foot flattens out, your big toe joint separates from the second toe. And you can see right there, that's a bunion as it buckles out like that. So a bunion is a flexible disorder. It's much more likely to happen to women, especially between ages 20 to 40. So especially women that get pregnant, that wear unsupportive shoes. So you got your high heels, your flats. If it's usually not men wearing big Red Wing work boots. So that type of gigantic work boot makes arthritis much more likely common in men, whereas a bunion is much more common in women, and it is much more common in people who are flexible on their feet, and it's essentially a dislocation of the big toe joint. So up here, I'm gonna send a link. We have a whole video on how to treat your bunion at home. So the top 7 home treatment guides. So products you can get and podiatrist options that can help you. So click that link, and that's our video on bunion solutions. If you're still here, we're moving on to cause number 2, hallux rigidus. Hallux rigidus is much more common in men who are on their feet all day, although it can happen in women as well. So what hallux rigidus is it's not a dislocation of this joint right here, but hallux rigidus actually is extra bone growth. So when you look at this joint, as I separate this joint right here, you can see there's a gap in between there. If the joint gets impacted, broken, jammed repeatedly thousands of times with thousands of steps under 200, 300 pound body weight. Sometimes I've seen this happen on people stepping on a curb and just jamming their toe and not letting it heal properly. The cartilage cracks. And the way I like people to think about it is it's kind of like if you used a fork to scratch on the surface of your frying pan, you have a defect there that never gets better. That then becomes bone-on-bone arthritis once it keeps rubbing for years and years and years and starts to cause problems. So eventually this has 4 stages. And we do have a treatment guide if this is you, if you have a big bump, if you're a man who broke your toe, but it can happen in women. Bunions are more common in women in general, hallux rigidus more common in men, and gradually it goes through 4 stages. Stage 1 is the chipped cartilage, then a little bit of bone grows at stage 2, a little bit more bone in stage 3. Stage 4 is bone on bone arthritis with a huge fist-sized lump that's growing on your big toe joint. So there's definitely a few x-rays we're going to show here that have that happen, but if you didn't click on that link already, this is our guide for hallux rigidus. There are some good home options, but there's also some surgical options. Number 3 is osteoarthritis. So very similar to hallux rigidus. Hallux rigidus is osteoarthritis with a straight big toe joint. So when it's straight and it doesn't bend, that's hallux rigidus. But Bunions, Hallux rigidus, and all the other disorders we're going to talk about can start to chip and lose cartilage, especially once you get into your 60s, 70s, 80s, 90s. Your cartilage starts to rub away. And unfortunately, no matter what all those commercials you see for $5,000 off-label cures, there's no proven great way to get cartilage to growing back. There's some stuff that can help, but it's never as good as being a kid again. So again, 4 stages towards osteoarthritis. Starts with a cartilage chip, then it becomes some more rubbing, more loss of cartilage, then more loss of cartilage and more bone, bone on bone, and then stage 4 is full bone on bone arthritis. That's unfortunately what happens. It happens to all of us with more joint use. And the sad part about osteoarthritis, here's my little rant. The sad thing is, from the time you're about 20 to about 65, I've heard this number cited. The average human being loses about 40%, so 4 and 0% of your muscle mass, but usually you gain even more weight. So you're weaker by about almost 50%, and you're probably carrying about twice the body weight. That's not a great combo. Your joints are unaligned, the ligaments are stretching, the bones rubbing inappropriately. That's how you get arthritis. The cartilage wears away over the years, and it becomes thick, painful bone. Number 4, gout. When you have pain at your big toe joint right here, so when your big toe joint starts aching, that gout is uric acid crystals. So uric acid is something that everybody makes. So 90% of the time, what happens is we don't pee it out enough. So we can't get rid of it quickly enough. It's a DNA breakdown product that enzymes in your bodies can't digest. It creates little crystals. So it's called the King's disease. So kings had it before, or royalty. It's when you drink a lot of wine, you eat a lot of protein, that's a lot of DNA buildup through the site. And what happens is you can't digest it and metabolize it, and you can't pee it out quick enough, and that crystal accumulates in your bone. It goes to areas that are the coldest and have the least blood flow. Surprise, surprise, big toe joint. 90% of the time, gout happens at the big toe joint. But if you want to treat gout, click on this link. Gout will have a lot of great solutions, and usually you can get rid of it if you haven't had like 8,000 attacks before. So if it's your first or second attack, by getting in good shape, doing a couple great things that our link here shows, you can take care of this problem. Absolutely. So gout is more of a digestive issue. I like to think about it like this. The DNA breakdown, if you don't digest it quickly enough, it's kind of like putting sugar into a cold glass of water. What happens is when it's cold water, so especially in your toes, it kind of sinks to the bottom and forms the crystal. That gets gunked up in your big toe joint and kind of slices up your joint, and that's why you have pain. If you wake up in the morning with burning 10 out of 10 pain and you don't know what caused it, and you probably had some beers the night before, you ate a lot of food, you didn't drink a lot of water, that's gout. Most likely. But the only way to know it for sure is to poke it with a needle, drain it, take a sample. So that's number 4, that's gout. Number 5, so we're on number 5 right now, turf toe. So turf toe is when you're an athlete and you're running and you go boop, and your big toe joint sprains. So you can see around your big toe joint right here, you have a lot of ligaments and capsules. So what happens is if you're running, especially in football or baseball, and you land and you kink your big toe up, you can rip the ligaments underneath your joint. It's no different than spraining your ankle like this and pulling an ankle ligament. The turf toe is a sprain of the big toe joint. There's a couple classification systems, but there's usually 3 grades. 1 is just a little tweak, nothing too bad. 2 is a partial tear. 3 is like a dislocation, and some of the bone can actually rip out with the ligaments. So it's a rough scale, but if you have turf toe, boom, this video up here will show you how to take care of your turf toe pretty quickly. But just like treating an ankle sprain, you gotta rest it. and it takes longer to heal than the average person thinks, unfortunately. It does take a little while. So that's turf toe, unfortunately. 6, so we're moving on to number 6 right here. We're talking about sesamoiditis. So sesamoiditis is down here, you can see there's 2 little bones right here. So you have your tibial sesamoid and your fibular sesamoid. It's possible if you have a very high arched foot and you land on your big toe joint on hard concrete, you can crack one of these little bones. So if you break that bone, that's a sesamoid fracture. If you just bruise it really bad, that's sesamoiditis. So sesamoiditis can lead towards a lot of pain, especially if it's on the bottom of your big toe joint. When you take your thumb, or your index finger in this case, since I'm looking into a camera, and you rub it on that sesamoid there, that's how you know it's sesamoiditis. So there's a lot of great solutions for sesamoiditis. I'm gonna link our treatment video up here, but generally modifying an insert very well, protecting that bone, gradually will get better. They used to do surgery on this stuff, but in my opinion, the surgery does not work well. It's impossible to lock up that little bone with a screw. You're gonna be very unhappy with any type of surgery on your sesamoid bone. Number 7. And I always toss this in right here. It's nothing's wrong with your big toe. What happens is sometimes we see, and this is a hard one. This is why I left this one for number 7. This is where people get pissed off at their foot doctor. Sometimes you get a very large person with diabetes or a smoker or kidney failure or someone who weighs 300 pounds and can barely get up out of bed, and they say their foot is hurting and they're having a lot of pain through their big toe joint. We can x-ray this, we can get an MRI, nothing's broken, nothing's dislocated. At a certain point, your feet are small little structures that have to hold your body weight. Just like I punch my hand right here and it can get bruised after a little while, if you're walking barefoot on hardwood floors with zero protection, your foot's gonna hurt a lot. Your foot is gonna hurt a lot. So you gotta take an honest look in the mirror. And I can say this on camera because no one's gonna come beat me up here. If I said this to a patient, I would probably not make it out of clinic that day. You know, in fact, I tried to diplomatically bring this up to somebody once and they almost took my head off. So if you sympathize for podiatrists, give us a comment down in the comments to show us a little bit of support. But the bottom line is, number 7 is, if you are extremely overweight and you don't work out and you have no muscle mass and you're walking barefoot on floors or you're working all day on hard concrete floors, there may nothing be wrong with you. And you may just be having a ton of bruising and a ton of foot pain. This is very possible. So you may have completely normal foot structure. And in fact, this is the case a lot of the times. But here's the top 7 again. So the bottom line is, that's the top 7. If you want to watch more, click on the following guides, but that's how you take care of your foot pain.